I first heard of Dr. Dennis several years ago. My daughter was suffering from mold sickness, and we had her treated at a special clinic, and they kept talking about this ENT, Dr. Dennis. It was sort of cutting edge, and so I finally reached out to him years later, and we've become sort of friends, and I wanted to introduce him. So it's a long introduction, so I'm going to cut it down a bit. With all due respect. So he is an attending physician. He started as an attending physician and a clinical instructor at Johns Hopkins in Baltimore. He's now in Buckhead, Atlanta, Georgia, as an ENT with nearly 40 years of medical and surgical experience treating patients with ENT disorders. His expertise includes endoscopic sinus surgery, balloon sinuplasty, CO2 laser vocal cord surgery, nasal plastic surgery, and ear surgery for hearing reconstruction. His current focus of practice now involves addressing fungal sinusitis and other toxins that can lead to neurological disorders such as migraines, tremors, cognitive decline, severe fatigue, leg weakness, paralysis, deafness due to mycotoxins entering the brain through the paranasal sinuses. So he's a pioneer in this, and he actually asks his questions about that. He asks his patients questions like, do you know if you're suffering from mold or mycotoxins or Lyme or things like that, things that most ENTs never even ask. And as dentists and other medical practitioners, we need to be aware of this because this is something that's more prevalent than you realize. So anyway, I want to get him started here without any further ado. Dr. Donald Dennis will be on the screen here.
I want to thank all of you, Dr. Cole, Becky, and Farah, otherwise, and all your audiovisual team. Otherwise, this would have never happened. My computer blew up today, so I had to go home and get another one. Anyway, this is I'm going to, if you'll get a paper and pencil, because there's some things I want you to write down, and there won't be many, but I want you to write them down. So this is the first slide.
The air you breathe is 5 times more important to your health than all treatment rendered by hospitals, doctors, and medication. The air you breathe is 2 times more important to your health than your genetic code. That's extremely powerful because if you fix your air, it's twice as effective as fixing your genetic code with no side effects. Nearly 60% of all preventable deaths are due to the condition of the air at home and at work. You breathe 1,080 gallons of air per day. So no treatment can overcome that much volume. The air must be clean in order for you to get well.
So this is just what you saw before. These are the 3 basic principles, and I'll go on to the next slide. So the CDC had Awareness Week in August of 19 that mold was a major cause of disease. So what we do is we use SDA auger plates from immunolytics lab, and we tap test the patients, and then we get it back and see how many colonies were on their clothing. So because if it's in their clothes, it's in their nose, and then it's in their brain. And we got a questionnaire, and we pay attention to how things smell. Sometimes you can smell people when they come in; they're real be musty smelling. And then we use urine mycotoxins and IgG serum levels to determine if they have a problem. This is just the names of fungi on the left and the mycotoxins they secrete on the right. But this slide is more important. Went to the pathology lab and assayed all the cancers that are in there and found out that 80% of the cancers have mycotoxins in the cancer that's known to cause malignancies. So just treating an environment will certainly remove some of the cancers people are getting. These are the environmental requirements. HEPA air filtration, we use different kinds to do that. Central dehumidification between 40 and 50%. And it's got to blow on the coil, which is not what the manual says. So we want to keep the coil dry so it doesn't grow bacteria. And then this is one of the things I want you to write down. Get this plasma pure ionizer by Well Air, and I'll give you the phone number in a minute. Anyway, this thing makes 1 trillion ions per second with no ozone and no hydroxyl. So it removes all the mold, mycotoxins, viruses, and bacteria from the air, not the contents. So you can put that on your central system, and they also put it in a fan for travel and put it in a room with it. And it really works. It's amazing. And we use an April 5000 filter, and there can't be any fiberglass inside the system that's exposed because it's like cotton candy for fungus. It grows mold rapidly. And 20% of the population are sensitive to it. This is the fan I was talking about. This is that ionizer. Put it in the fan and put a HEPA filter on the back and just take it with you. It weighs about 4 pounds. And put it in whatever room. It'll fill up a room in under a minute. So it's rated for 6,000 CFMs, which is a commercial size fan. And it cleans itself. So this is what it looks like. And that's the phone number. Just write that down to get this thing. I've got about 10 of them. So you want to keep it to focus on getting clean air and a clean diet. No sugar, gluten, and dairy free. And you're going to eat protein and complex carbohydrates. And you can't have chlorine in the water because it grows. It kills everything else, and then fungus grows. This is how the air enters the nose through the olfactory bulb, but this isn't the main way it gets into the brain. You know how people used to sniff glue and get high. Then you take the glue away, the high goes away. Well, these VOCs and mycotoxins go into the brain through these membranes in the sinus passages. I'll show you that in a minute. So to control chronic sinusitis, you have to control the air quality. So this is the definition of clean air quality, and it's much more strict than what the people who measure air say, because this is what the sensitive people have to have: 50,000, under 50,000, 0.3 micron particles per tenth of a cubic foot, and the mole counts have to be 0 to 4, and if they're really sick, it has to be 0 to 2 on a mole plate. So this is the power of removing the antigen, meaning the fungus from the sinuses. So this is the patient in the pre-op room, and this is the patient after surgery. So this is 2 hours later. See all this? This is 2 hours later, just removing the fungus and mycotoxins in his sinuses. And this is another one. See these legs? This patient had a heart transplant at age 3 months, and now she's 25. And this is her legs. And she's been to 4 dermatologists and done everything known to man, and nothing helps because she's got all this fungus in her sinuses. This little white ball is a fungus ball. And all of this is polyps and fungus and mycotoxins. And these are eyes. And so all this stuff is going into the brain. And I'll show you that in a minute. But this tissue is the tissue we removed from her sinuses. That's a polyp. And this brown halo around the polyp is mycotoxins coming out of the tissue. We'll show you how we did that in a minute. But this is her face, and this is her hand, and this is 6 days after surgery. So you can see this person has a problem in their house, and this person looks like they don't. Well, the mole counts are the same in both of these rooms down here. So you can't tell by just looking. You can tell by the way a room smells, and then you do mole plate counts. Now, this is why these people get chronic sinusitis. It's a T cell receptor defect. And instead of the antigen binding here where it's supposed to bind, it binds on the side. And when it does that, it deforms all the other sites. So they get chemical sensitivities, and the normal amount of T cells to respond to a mold antigen would be 0.01%. But 20% don't do that. They do 3,000 times that. And there are 3 inflammatory mediators: interleukin 5, interleukin 13, and interferon gamma that are released when this fungus docks inappropriately to the side. So that's 9,000 times the systemic inflammation. So this causes systemic toxicity affecting every system in the body. And also they get staph intertoxin B and fungi and nasal polyps. And we found the MRV vaccine helps these people. And this is this pink line represents the mucosa in the nose. And this is an eosinophil, and this is the fungus. This is going to represent a fungus docking with eosinophil. When it docks with eosinophil, it releases a major basic protein, and the major basic protein burns a pit in the lining that's microscopic. So then all the mucus sits in these pits, and it gets bacterial infections. So everybody's chasing the bacteria when really the only thing wrong with them is they're breathing fungus and they're reacting to it. So you see down here, the eosinophil releases interleukin-5, and the T cell releases interleukin-13, and then it just circulates around and it makes more and more of the same thing. And I'll show you what that looks like inside the nose. So this violates all the rules for a slide. So basically, this is about what fungus does. They all have the same 1,3-beta-glucan structure. And so airborne fungus causes all these things down here: inflammation, food allergies, muscle joint pain, gut problems, acid reflux, and multiple food allergies. So this is what those little pits on that diagram look like. These represent thousands of eosinophils that go into the sinus cavity and cause it to submucosal bleeding, which destroys the cilia. And that's what causes chronic sinusitis. And it happens in the lungs too, but everybody doesn't get lung problems. That's at least one good thing. And this is the same issue. These eosinophils have ruptured so many times and released major basic protein that it destroyed all the mucosa down to bone. So this is a scab over bone inside the maxillary sinus. And this is what it looks like up here. And so you can see why they get so sick. And this is fiberglass floating in the air, and the particles are even smaller than that. So you can't have any fiberglass in your airstream. So if this is in the attic, the system has a negative pressure, and by Venturi effect, this gets sucked into your system, and this makes people sick. So this is candida over here inside the nose, and everybody wants to use big sprays and all these things for chronic MRSA, and it's really not necessary. So all we did, we used amphotericin spray and all antifungals, and this is what it looks like in 2 weeks. All the fungus is gone. This is candida here. And so this is candida, and this is what the environmental air was in that patient. They had 48 colonies. And this is when we couldn't get rid of this with antifungals until we fixed the air. So when we fix the air, all this goes away on the same treatment as they were getting over here. The difference is they don't have fungus in the air anymore. So this is a big fungus ball in the sphenoid sinus, and that white stuff is calcium, because these people, when the fungus digestive food, it releases calcium, and you can see these calcium plaques on a CT scan. So this is the fungus ball inside the sinus, and this is what the environment looked like. And this is another one. All this is fungus in the ethmoid sinuses. We removed the fungus, which is here, and this patient was having severe lung disease, and she was allergic to all the antifungals except amphotericin. So I talked to the pulmonologist, who actually listened, and he scoped her and then irrigated all of the bronchi with amphotericin, and then she was well because she couldn't use any other antifungal. So this is what happens to the brain when you breathe fungus and you're allergic to it.
This is patient Linda Stanley, who was noticed vertigo and cognitive dysfunction. Can you tell me what happened to you?
I was on an airplane on Thursday, flying 2 times that day, and later that night, early the next morning, started feeling dizzy, vertigo, fuzzy head, impact on my sinuses.
And then what happened to clear it up
For today, when you did this procedure,
with amphotericin into the sinus?
it immediately cleared my head. No more vertigo, no more fuzzy thinking. My sinuses opened immediately.
And this is what this looks like. This is just, she's had surgery, so you can just squirt this inside the maxillary sinus. This is just amphotericin. And then after you do that, wait about 30 minutes. And then this is what happens to the brain. So this is acute EEG, and the red area is high voltage and disorganized thought processes. And the right side is normal. This is what happens to this patient 30 or 40 minutes after we put that in. Her whole QEEG changes. And these patients were not performing well in terms of following instructions. So we did a P300 is an audiometric test that measures the time it takes for the sound to get from the eardrum to the brain. And normal is 300 milliseconds. So you see, and when these lines cross, that means the brain has heard the sound. So this is a patient where the lines never cross. So they'll go home and not be able to do anything you told them to do. So I have them write it all down. If they write it, it belongs to them. And then this is another one where it was 461 milliseconds. And normal, of course, is 300. So they don't have normal P300s. And so this is a patient where we biopsied and removed all this tissue from the sinuses. This looks like not a bad situation, but it's worse than what the CT shows all the time. So we took this out, put it on a mold plate, and after 4 or 5 days, it has a brown halo around it. So then we sent the piece of tissue and the brown halo to the lab to test it for mycotoxins. So both of these have the same mycotoxins. So when you see a brown halo, that means it's mycotoxins leaching out of the tissue into the SDA agar plate. And these are the assays. And so this is what that did to this patient.
My symptoms were suicidal depression as well as anxiety. My treatment was numerous SSRIs, tricyclic antidepressants, as well as SNRIs. I also received just under 20 electroconvulsive therapies to my brain to help to treat depression. I also was institutionalized for my condition, and I was considered to be treatment resistant. I recently just had sinus surgery with Dr. Dennis, and it has completely revolutionized my psychiatric condition. I am no longer experiencing any depression, nor am I experiencing the extreme anxiety. I feel as if he has saved my life, and I am no longer on any psychiatric meds. It is a complete miracle. Thank you, Dr. Dennis.
So you can see why I go to work every day. So this is that patient. This is her brain before surgery. You see the high voltage in here. This is post-op. The voltage is massively improved, but this is the final improvement here with after you do QEEG, they do neurotherapy. And the neurotherapy is a passive thing they do every day. It takes about 2 months to get this cleaned out. But if you don't fix that, they have severe OCD, and they just OCDing all the time about fungus. So it's fixable by just doing neurotherapy. Here's another one, the same kind of thing. This is the tissue, this is the brown halo, and that's the fungus right there. There's another fungus over here, you can see it on the plate. This is what it looks like surgically. So this is showed if you biopsy another patient that doesn't have chronic sinusitis, you see that they don't have the ring around it. So that's your control. And so the brown halo, just by doing both of these tests, shows that the brown halo is really mycotoxins. This is what this instrument looks like. It's called a Cyclone, And without this thing, you can't get the toxins out of the sinuses even when you open them. So it has 6 ports, and it's like a pressure washer. You'll see in a minute. So, and then it sucks at the same time. That's how fast it sucks. And this is a sinus.
Second.
So that's how you get all this out. This is before and after. This is like a week after surgery. These don't look like the same people here. This is just cleaning all that stuff out of her sinuses. This is what was making her sick, because the mycotoxins and fungi inside the sinuses are producing more mycotoxins, which is going into the brain. And so you can see this is the toxin coming out of that. This was this patient here. So he had hearing loss for 10 years. And he comes in the recovery room, and his hearing loss is recovered.
I would guess that I've been brought out of anesthesia for about 20 minutes now. And the first thing I noticed as I came to is my hearing has improved drastically. I can hear the conversations of the Mycotoxin. I'm still trying to determine if the sinus is completely gone or just mostly gone. The ringing is obsolete in my ears. I haven't been able to hear this well for at least 10 years.
Now, all these patients get pituitary damage of some degree. So the toxins go from the pituitary, from the sinus into the pituitary gland. And we did several of these, and I wrote this paper with 2 endocrinologists. And we found that 51% had growth hormone deficiency, have injectable growth hormone to recover. So, and we knew this because when you operate on them, they will have a slow healing. And so I sent them to an endocrinologist and told me he was growth hormone deficient. And they didn't believe me, and I'll show you why. Because this TSH was 81%, ACTH was 75%. So if you look at the normals, I'll show you this. See, the average was 123. Well, the normals are 88 to 249. So the average one had a normal level of resting growth hormone. But if you talk to the patient that was severely fatigued, and if they hadn't challenged the pituitary gland to make growth hormone, they would have never known they couldn't make it just by looking at the labs. So the labs can't go by that, and that's what everyone goes by that. So 51% were growth hormone deficient, and if you don't give them growth hormone, they never get better. So you can give them some Morlin if they can make growth hormone to boost it up to around 250, and then they do a lot better. So this is a example of after the surgery. What he has Parkinsonism.
Baker, 6/25/18. The left tremor of the arm. Winston Baker, 6.
Okay, so look at him now.
This is after treatment of mycotoxicosis.
And this is another one. This guy's in a wheelchair for 2 years.
This is Tim Green. Fibromyalgia, muscle weakness. Now go backwards. And then sit in the chair.
Okay, this is him about 6 weeks later. He had surgery, but it didn't work. He did everything to his house in North Carolina, but the mole counts were too outdoors for him. That's kind of rare. It's about a single-digit percentage, but this is what happened to him.
Hi, I'm Tim Green. I'm now living on the coast of North Carolina, and I'm living right here on the water. There's no grass, no trees, just the breeze off the ocean, and I'm doing so much better. My health is tremendously better now because I'm living where there's 0 mold count. That's made all the difference in the world in my health. I had severe headaches. I was in a wheelchair for over 2 years, living in the mountains of North Carolina where it rained all the time and there was mold and trees everywhere. And now living here where there's a zero mold count. I'm healthy. I'm walking again, and praise God, life is good. Thank you, Dr. Dennis.
Yeah.
So this is a patient who had paralysis of the leg, bladder, and a mass around her spine, and blindness in the eye.
This is Jennifer Parrish, who had a severe mold exposure in a trailer and has trouble walking. She has paralyzed left leg and inability to evacuate her bladder or bowels. And she's had 3 episodes of this after living in a trailer where her cat died and got leg paralysis as well from the mycotoxins.
Okay.
This is Jennifer Parrish on 11408. Patient had right eye paralysis and right eye blindness. Now she can look all the way to her nose, and she couldn't do that before. She had left leg paralysis. Stand up for me. She can walk easily. Go back that way. With her left leg, she can support her weight on the left leg. Lift up your right leg. Lift up your left leg. So she's got all her strength back, and her neurogenic bladder is over, so she can urinate properly, and she had a mass around her spine, which has gone away. This is all those Sporanox and vitamin supplementation, and her vision is coming back while they're healing her for heavy metal.
This is to show you what happens. This guy couldn't walk too well. That's the best he walks. This is after I finished with this, about 6 weeks later.
Here you go.
All right, so they all ask, once they get well, when can I go back in the mold or eat sugar again? And this is the answer. He came back to me a month later and got a moldy car at the airport and drove it 30 minutes to my office. So this is 30 minutes of mold exposure. He's almost like he was before. So and this is a patient. She's a dental hygienist, and she had a moldy apartment, and the dental office was moldy too. She had vocal cord paralysis, and then she got over that after she got out of it. So we can move on, be a little bit faster. This is what I want to show you. This is new technology that's not available yet. But what we did is we took all the mycotoxins in test tubes and took them and got CT scans and MRI scans of them, and then ran, and using the urine mycotoxin level, whatever mycotoxin was in the urine, we took that test tube and ran 7,000 algorithms till you could see something in the test tube. So you can see gliotoxin shows up as a black substance. And we biopsied this patient, and we know that the biopsy contained gliotoxin. So this confirms that black spot is gliotoxin. So this is the first time in history we've ever been able to see this in a CT scan. So this guy has severe migraine headaches. So he had a colloid cyst in the left ventricle of the brain, which you can't remove. And this is the test tube. It's just white substance. Looks like water. And this, after you run the algorithm for gliotoxin, which he had in his urine, it's this blue thing with red spots. So the same thing shows up inside that colloid cyst. So the gliotoxin caused the cyst to form to protect the brain from the mycotoxin. That's amazing. Anyway, so, and then you can see these little white spots. These are infarcts between the gray and white matter, because that's where the vessels are smallest. And the inflammation of the mycotoxins caused this. But this is what she really had all this toxin in the brain. And this was gliotoxin again. Now, this is the case of the century here. So this is a test tube with gliotoxin. This is an MRI scan. This black thing is a pituitary tumor that's secreting cortisol. So the patient had a 100-pound weight gain in a few months. And then we took the algorithm that we used on this MRI of the test tube with gliotoxin and ran it on the brain. See, all this black stuff is 11 mycotoxins. Because when we got those those black spots in there are the mycotoxin in the south pituitary gland. That black tumor was removed so the patient would stay alive. And we got the neurosurgeon took it out through her nose, and then we got the part of the pituitary tumor, and we assayed it for mycotoxins by using mass spec. We did 2 different assays to make sure it was correct. So the black represents 11 mycotoxins, not 1 or 2. So this is what you see in the brain. And this is the same testing of that pituitary tissue up here. So all of them are the same. So that's a real validation. This is that patient before surgery, and this is about a year later. And this is the cartilage grafts over the pituitary gland inside the nose. So this is just, you can see this stuff in the sinus here, but you can't see mycotoxins until you run this algorithm. So you can see the mycotoxins in there too. And this is a huge pituitary tumor. And this guy, this is a cadaver showing you the anatomy. So this pituitary here, the optic chiasm's up the top. So his optic chiasm's getting stretched, and his internal carotid artery is getting smashed by this tumor over here. Now this is what was in his brain here, and this is an MRI scan, of course, which can't see that. And then this is it's migrating down to here, but the majority of it's been removed by our protocol. We use oxygen, glutathione, NAC, and OptiCleanse and liver cleanse, and then irrigate the nose with amphotericin. Now, this is a different algorithm. So this is the mycotoxin down here, and above here is air. But in the air, there's some VOCs coming off of this in the air. So if you see, he's got air over here. Now, over here, there's no air, but you can see this white stuff. So this may be the first time we've ever been able to see volatile organic compounds in a CT scan. So what do we know now from this technology of AI imaging? When one mycotoxin is present, it is 10 or more really present in the brain. And some pituitary tumors are likely caused by mycotoxins, since they're found in pituitary tumors in high concentrations that are known to be tumorigenic. So the tumor, and these tumors have a high rate of recurrence. So the airborne mycotoxins enter through the nose and are randomly distributed throughout the brain. And mycotoxins can be removed from the brain with a combination of environmental, medical, and when indicated, surgical and irrigation with amphotericin. This just says what we do with that. We have a fogger here. We fog the patients. And so this is what, when the patients are really toxic, I have to protect myself. This is oxygen, and I've fogged all this stuff. But most of them, we get their environment straight before they get in there. So if I don't get better, what's the checklist? The first 10 things you do is check the air. Usually it's unidentified fungal load in the air. So you got to get that off the table first by tap testing. And then you can do urine mycotoxins so you know that they're breathing it. So we get the urine mycotoxins before they come in, so you don't have to have any discussion about how they don't have fungus in their air, because they do. They just have to find it and get rid of it. You can't have sugar in your diet. If you do that, you can't get better, and the pituitary may not have been addressed. So, or they have co-infections or heavy metals. Almost all of them have these co-infections. We see a lot of people who have Lyme's, but their primary illness was fungal exposure. Then they got the Lyme's because they got bitten by the tick long before the Lyme's ever showed up. And so some of these people have MTHFR, so they can't methylate B12, and that's why they can't detoxify their body. And then this is rare. Some of them get tumors, but that's rare. So first, if you get the patient mold-free environment and remove from the nose and the body, they get better. So now let's have we need some time for, we still got some time here. Okay, this is what we do. This is all the treatment we do. So I'll wash the nose out with salt water and then nebulize with amphotericin or voriconazole. And you wear oxygen 10 liters a minute for 2 hours a day at different times when you're doing something else. And then you titrate. If they have a symptom, you back up and you titrate. Whenever they have a symptom, you stop. And then you detoxify the liver with these two things, or any combination you want to use. Glutathione and nebulize it. And then we use Intermax. So this is the rest of it. Most of them have GERD. Most of them need vitamin D. And then you got to heal the gut first. So we do large volumes of probiotics, and we do toxin binders. I don't have to do a lot of these, but these work. And then you got to do the yeast diet. That's key. If you don't do the diet, they don't ever get better. And these are the antifungals we use, kind of one at a time. But you can use nystatin with anything. It stays in the gut, doesn't do anything to the liver. So you could use it forever. It doesn't matter. And then, so remove the antigen from the nose and body and brain, and then you get better. And then you got to use normal saline, antifungals, antibiotics sometimes, and appropriate use of the antifungals. And then we get MRV vaccine is a combination of strep, staph, diplococcus, pneumococcus, and haemophilus. And we give them that vaccine, and that takes care of the bacterial side of it usually. And these are our resources. This is sinus5.com, and Sinusitis Wellness is information on this. Is actually a website that has solutions. Okay, so that's all I need to say, and then we can have some questions now. You got any questions?
Yeah, because he's not going to be at the speakers forum. So hang on, Dr. Dennis. There's a question coming.
Thank you very much for this. Wow. Where can you order these mold plates? Do you have any referrals?
Yeah, this is when you want to write it down. Immunolytics Lab, IMMUNOLYTICS, Immunolytics. And you get the test, but tell them you're going to do it in your office, unless you can do it in your house. When you buy the plates, you're paying for the reading of the plate. So like it's $35 a plate. But if you have them in your office and you tap, they'll usually do the patients for free for you. So we send the plates in. All the patients get tap tested, and they all get urine mycotoxin levels.
I got a question for myself, actually. My family, we've been dealing with it, with mold in our 5 years ago. We moved out of our place we were renting. And as we were moving out, we saw the entire back wall behind my son's dresser was wet. We've been living in that for a while, and he had this like chronic cough, and my other daughter was having a tough time. And so we moved out, and we're like, all right, cool. We moved out, that's better. And then we lived in another place for 4 years, but all of my kids were really sick for some reason. And I had like arthritis, and my wife did too. So we got our place tested, and sure enough, had really like wild amounts of mold. So then we moved out and then we moved to a new place just recently, and we just tested it, and it also has mold. And it's been like so tough because my kids have been so sick, and it's like hard to, I know, but it's a little more than just cleaning, I think, though. So
Well,
my question for you is what should I do? Like
All right, the first, where do you live?
I live in California. Yeah,
Okay.
Orange County. Should I move to the desert? Is that what I should do?
Well, you can probably get a place there, but the problem is the way people construct things is not mold friendly. I mean, they put things in there that grow mold, but basically, you go in and you see how it feels. Can you tell it's bad pretty quickly?
Yeah, that's the Stachy, I think is one of the molds.
But
Yeah.
Stachybotrys will kill everybody. So if it's
Sure.
got that, just run. You can't fix that.
That's the one that we're in right now. Yeah.
You're in Stachybotrys right now?
Yeah.
Perfect. Okay, leave.
Okay. Well, I mean, yeah, that's the plan. I just found out yesterday. We just got the
Alright, so
mold
we-
test back yesterday. So we're probably going to be moving out this weekend.
So what
But-
you probably want to do is get one of the newer trues, like the Hilton trues, or some of the ones that don't have carpet and they have what's called clean rooms in some of these hotels.
Sure.
And you want to get one of those that got the HEPA filter. You're more likely to be okay there. You want a bus stop before you go looking for another place,
Sure.
because you want to be real careful when you do that. You want to have some time. You want to be able to plate it and see how you feel in it. So the magic word in the world is asthma. So when you're doing a contract on an apartment, say, look, we got asthma, and there's some places we can't breathe in. So we need it 4 or 5 days or a week or 2 weeks to determine if we can breathe okay in here. And if we can't, we have to be able to leave. And if you put that in the lease, we'll sign it right now. So most people will help you with asthma, but they won't help you with mold. So don't even say mold. You're just wasting your time. When you say the mold, the person you're saying it to has an IQ of about 2 after you say the word. So you can't get anywhere saying mold. But that's how you give yourself some time to get out of a lease, and then go at a hotel first where you feel good, so you're not in a hurry. And then you go in and see what's your first impression when you go in. Does the air feel clean and crisp, or does it feel heavy? If you don't know, it's no. Next, go to the next one. It's got to be obvious that the air is clean.
Sure.
And if it is clean, then you start testing that, and you do mold plates everywhere, and then you do your other testing before you rent or buy. That's the only way. And the kids, you'll have somebody who's gifted who can tell they don't feel well pretty quickly. That's what you're looking for. That's your bird dog. So is one of the kids like that?
So should we follow that protocol that you have and just be in a place that's, I mean, you said clean the nose, clean your body, have clean air, and that
Yeah,
should
you do all
resolve.
that stuff, and then go on, irrigate your nose out, and you can use antifungals on the website, which is Citra Drops, which is antifungal, viral, bacterial, and just follow what it says to do there, and get on the it's called Candida Rid, and all that's on that website, and then use glutathione, NAC, liver cleanse, and start all that stuff while you're waiting, and then take your time and get you some mold place, and take your time trying to find another place. I really feel sorry for you. I mean, I know what you've been through, and I just wish I could reach out and help you. But this is the best thing. You've got to get very wise environmentally.
One more question here.
Is that helpful?
Yeah, it was helpful to him. I'll talk to him too, Dr. Dennis.
Okay.
Okay, before my question, can you give that website again for those products that you'd indicated it was really fast? We couldn't hear it very well.
You got garble there. Can you go slow and say that one more time?
The immunolytics, the website you had just mentioned about the products.
Yeah, immunolytics is the place where you get mold plates. The place where you get the products to treat yourself with is called sinus5.com. Sinus, the number 5.com. Makes it easy to remember.
Very easy. My question was about the Amphotericin. Do you have a protocol that you recommend that you could give some of us that are learning this?
What we do is Yeah, so write down the way you want to mix amphotericin. Remember, it goes into still water, not saline. And you're going to put grams per ounce of distilled water. And you use a nebulizer called a Rhino Sprint, And you get that online. And you put 2 cc's in there and use 1 cc on each side. But you irrigate first. And the best irrigation system is called a Navage, Navage. You get that at any drugstore or online. Amazon has it. Navage. You put the salt packets in there, and then you put about 4 drops of citral drops in there. So you do that first, and then you nebulize, and then do the oral stuff. That's the basic thing to do right now. And if you find a compounding pharmacy, they can call our compounding pharmacy and, get the way to mix all this stuff. Our compounding pharmacy is 404-350-5780. And guy's name is Brad or Tate. They know all the formulas. So you got to get it in your nose, and you can take it orally, but you got to watch your liver enzymes if you're going to take any of the azos. You can watch them monthly, and don't overdo it. So more is not better. Any other questions?
Dr. Dennis, can you repeat the phone number one more time?
The formula for what?
The phone number for your compounding lab. Phone number.
Okay, so you're going to take 1 ounce of distilled water and put 3 milligrams of amphotericin in that, and it'll dissolve. And you're going to then use that solution to nebulize your nose with, or spray your nose with.
Okay, can you give us the telephone number of that compounding lab too?
It's 404-350-5780.
Okay, we have just time for one more question. Can you talk at all about the HLA gene and what we can look for in our patients?
Well, the genetic, there's nothing wrong with it's really kind of redundant because you already know the person has a mole problem before you do the test. It's sort of like having a diabetic that you know is diabetic, and then you see if they have the genes for diabetes. Well, of course they have, So what you're going to do is take a history and see if the patient's sick, and if they have mycotoxins in your urine. That's all you need to know, But now there are 3 different genes. They're not related. One is chronic sinusitis gene, which is the first one I showed you, that they have the fungus. The fungus sits on a site, and it elicits 3,000 times the immune response. So 20% of the patients have that, where they get chronic sinusitis. Then there are another percentage that have chronic sinusitis and polyp formation, 2 different things. And some people have both of those. And then there's the one, this MTHFR, where they get rid of the toxin. And that's the major one for the systemic illness, being able to excrete the toxin. All those sick people could not secrete toxin. So they need methylated Bs in order to do that. And that the Intramax is the vitamin I use. It's called INTRA-MAX, and it's got 413 items in it bound to carbon. And the vitamins go intracellularly, and the carbon takes the toxin out of the cell. So measuring the genetics to me is not that helpful, because I already know they have it, when they sit in the chair. if you want to confirm it, there's nothing wrong with that, but the treatments, in other words, if it's not going to change my treatment, I don't bother doing it. So, and then other people have proved that HLL gene is not the only one involved. So you can have people who have a negative one of those, but still have the problem. So you got any other questions?
No, we're good, Dr. Dennis. We were out of time today. Thank you so much for working through the technical difficulties to be able to get online with us here today.